So I'm Pete Crvenkovski from the Erie St. Clair LHIN. Thank you, Don, for your introductions, and our colleague from Windsor, Essex Public Health Unit, Artaman. And so the way we've decided to collaborate on this is to show you really a high-level overview of the two LHINs that the LHIN put together. And then the Public Health Unit is doing a deeper dive and just showing you an example of how we can work with our public health units, leveraging their skills and analytical capabilities to provide further drill down and understanding for our target populations. Okay? So again, today, just introductions. Artaman, and in the back we've got Eniat and Sabir. They were the key analysts working on the public health unit side. So we wanted to do a high-level and crude analysis of our LHIN data, and just again reiterating that this is just a beginning of our journey with our public health units, and really wanting and needing to leverage their skill set in analysis. So we've had some recent collaborations with our public health units, more on sort of the programmatic side, and on falls and the prevention toolkit. So I think we've had about 2 done thus far, and there was a lot of engagement and collaboration, and we were just so excited that, you know, it was the meeting of the minds in a sense. And through them, we were able to extend our tentacles and reach out to their data departments. So there's a couple of mat leaves in 2 of our public health units, and plus, because I live in Windsor, I figured I'd save some gas money and work with our Windsor Essex group as well. My parents are aging, so I figured, hey, I better learn about the system and why people are falling as they're aging, so I can help prevent it in my folks. So again, Artaman, Eniat, Sabir, and myself. So why are we presenting today? And I think a pivotal publication by Ross Baker et al. Really talked about the continuum of care and how we can reduce avoidable hospitalizations through these 3 pillars. And I know there are pillars in the falls toolkit, and we'll let the experts talk about that. But I just wanted to bring this twist. And hopefully I think it gels pretty well, Bernie, with some of the stuff that you're going to talk about. But really, preventing adverse events, effective care transitions, and better chronic disease management. We think that these 3 things are really contributing to the falls in our LHINs. So, just so you know, we really pulled most of the data from IntelliHealth. The home care database and the long-term care raw information came from ePortal, but a majority of the analysis is around the emergency and the hospitalizations. And then we also want to, just pick your brain or plant some seeds for some potential future analysis. So from this, hospitalizations in 2009-10 for hip fractures. And we did a per capita rate for those age 65 plus. And as you can see, we've got our 2 LHINs, the total value in blue, the female in orange, red, and the male rate in green. Now, in our LHIN, we've got really high osteoarthritis rates. And I believe there's similar levels of chronicity in the Southwest LHIN. You'll notice, hence, across the province, females with their longer longevity and probably the osteoporosis is triggering higher per capita hip fracture rates. You see the males are typically lower, and Erie St. Clair actually has very high rates. So in terms of emergency visits, I did the per capita for 65 plus. When you see the public health presentation, you'll see they've done a lot more intricate analysis, and they've looked at different age categories, and they've done some age standardization. So they'll go into those details. And again, I can't thank them enough for their efforts. So the Middlesex, London, obviously it's your biggest population, and so they have the largest volumes of falls coming through for the age 65 plus. The next is Grey Bruce, and then you guys can sort of read down your public health unit regions there. From a trending perspective, they're really fairly stable, but you notice that Middlesex and London is sort of trending. Sorry, my Health Quality Ontario folks would teach me that there's no such thing as trending, so there's a trend up. So when we look at Erie St. Clair LHIN, Windsor is showing a trend up, and fairly stable raw numbers for Lambton and Chatham. So these are just crude numbers. But then, and this is a little harder to read, but I was trying to be cognizant of our time. So we just did some per capita numbers. So the first set of bars is Erie St. Clair, the total. Then you've got the 3 counties, and then you've got Southwest. So just for presentation purposes, you'll see, and I'm going to walk away from this for a second. You'll see Erie St. Clair here has fairly similar trend as the Southwest LHIN. And, you know, from a per capita basis, pretty similar. And then you can see the variations from a per capita basis. Remember, Chatham actually had lower fall rates, but from a 65 plus, they actually spike up higher than our other counties. Windsor Essex is lower. So over here, as you recall, Windsor Essex had Middlesex London had the highest volume, but from a per capita, they're actually driving pretty much the trend for the LHIN because of their size. Grey Bruce, and then you've got Huron that's sort of has spiked up recently. So we looked at the long-term care residents and their RHI, and we just looked at prevalence in terms of have you had a fall, and some caveats around these numbers. We know that the RHI is fairly new, and people are trying to really document more and more their falls rates. We also know that there's a lot of work being done in collaboration between the LHINs and Health Quality Ontario and other groups trying to bring down those rates. So there's a number of complicating factors here. I've spoken to some of our long-term care homes, and for instance, their falls rates, this one particular home, had fairly low fall rates in the data, but they said, Pete, why do you think we're working on this for residents first? It's not because we have low fall rates. So it just shows you that the data really still has some development to do, but at least you can see some trending, and there's probably more credence in the later numbers, because that's when sort of we've had the most submissions, I think, to the RHI process. So these are the actual numbers in relation to those percentages. But as you can see, we're slightly higher than the Ontario as a percentage of individuals having a fall. In home care, Erie St. Clair, and this is corroborated with a report from Health Analytics Branch. They did a report that they do a quarterly report, and it showed that Erie St. Clair had one of the highest rates of falls in their community care clients. But luckily, that trend unfortunately maybe, is that trend has increased, but so has the rest of the province. And Southwest has been really sort of neck and neck with the provincial numbers. So these are the raw numbers, you can see. So again, I think some things that we wanted to plant in your heads is, you know, how does chronic disease affect these numbers? We know that with multiple comorbidities, with you know, the higher acuity and chronicity, that people likely get pretty dizzy and have a fall. But we'd like to do more of an analysis on that. Can we use the LACE index? And I think Southwest LHIN has already started using that. And that is a predictor for the risk of a readmission. And our LHIN has started using that in 2 of our hospitals. And so how can we potentially use that to trigger some follow-up from hospital to community? And again, I think we really need to try to figure out, okay, so what does this data mean? Like, how do we action on it? So really the takeaways from our perspective is, well, we know some counties have higher numbers, but that's really about it. And so why is that? So this is just the beginning of the journey, and we need probably even anecdotal comments from you guys that are out there to help us really figure out who our target populations are. So I just wanted to hand it over to my colleague Ali from the Public Health Unit.
Thank you, Pete. We would like to show some summary data from Essex County, which is the largest county within Erie St. Clair catchment area. And so this presentation includes about 3 components. One would be introduction by me, and second one on rates and proportions by Dr. LHIN, and the last portion would be about some maps and possible spatial analysis for the future that could be done by Dr. Saber. So this part of the presentation would cover indicators, data source, and rates and maps. Overall, with respect to indicators, we do have some indicators such as mortality, hospitalization, and also emergency department visits. With respect to mortality, we are not showing you any slide for this particular event. For hospitalization, we could show you some crude hospitalization rate, age-specific hospitalization rate, age-standardized rate, standardized morbidity ratio, and also proportion of self-reported injury-related hospitalization that are due to falls. We could hopefully do some work on these data in the future through a regional collaborative framework. But just for the sake of today's event, we would like to cover emergency department visits at the county level. And so again, we would like to talk about crude emergency visit rate, age-specific emergency visit rates, age-standardized emergency visit rates. What we will not cover is a standardized morbidity ratio or standardized incidence ratio for fall-related injury. With respect to data source, as you all know, we do need some data for our numerator and also for our denominator. As far as numerator is concerned, we would like to have the counts for emergency visits. The original source, as was mentioned earlier, could be from CIHA, Canadian Institute for Health Information. They do have a data system called National Ambulatory Care Reporting System. And that set of data is distributed by the Ontario Ministry of Health and Long-Term Care through a system called IntelliHealth Ontario, which is the name for the interface to access the data repository. In fact, the database itself, Provincial Health Planning Database, includes a number of databases for vital data, for hospital data, emergency data, clinical data, long-term care, and so forth. So, as I mentioned, the IntelliHealth interface would open up a gate to a big database, a knowledge repository that contains clinical and administrative data collected from various sectors of the Ontario healthcare system, data related to hospital sector, community care, medical, vital, and population data, queries and reports through easy web-based access to high-quality, well-organized, integrated data. The denominator part of our rates could be based on some estimates of the population. And the original source of the denominator data is Statistics Canada, and specifically census data, and population forecast data, sometimes estimated by the Ministry of Finance. Anyhow, overall, some kind of data could also be provided through the Ontario Ministry of Health and Long-Term Care, same IntelliHealth Ontario. We do have alternative data sources as well, and those are Ontario Trauma Registry and Canadian Community Health Survey, the national survey. Many of you are familiar with the CCHS. And the last part of my introductory slides would be about Essex County, and I just want to give you a couple of numbers on the Essex County demographic picture. And population in 2011 is close to about 400,000 compared to Ontario, which is about 15 million. And this population was, in 2006, was also almost the same number. So overall, unfortunately or fortunately, we had a negative change of population percentage for Essex County, about 1%. And the other number I would like to show is the population density is about 210 per square kilometer. And that's all for now. I don't want to show you many other numbers. I would like to ask Dr. LHIN to come over here and talk about some of the rates that we have calculated. Thank you.
Thank you, Ali. Good morning, everyone. I'm very happy to be here, and I'd like to thank Pete for inviting us to this conference. As Pete has mentioned before, this is just a preliminary analysis, and the results are very basic and crude at the crude level. So here on this slide, we see the number of fall-related emergency department visits. This is just crude numbers, the actual numbers that will tell you the magnitude of falls-related emergency room visit. And clearly we see that the Windsor Essex County has the most number of falls, followed by the Lambton counties, and the Chatham Kent has kind of the smallest number of falls, but still they're in thousands, 4,000s. Okay, so.
If I may, just remember I showed you 65 plus, so he's starting with the whole population, and then you'll see some breakdowns.
Yeah, so these numbers are for the entire population in each year. So that's why the numbers are a little bit different than Pete's. Okay, so here, these are the percentage of fall-related emergency visits by region and by injury type in 2010 only. So I'm just showing the 2010 results. So the first column shows the type of injuries, and the middle three columns gives you the percentages for, the first column shows for Chatham Kent, The second one is for the Lambton County, and the last column is for Windsor Essex County. So these are the percentages, and these are for, excuse me. So these are for, and the last column is the total in Erie, St. Clair, LHIN. Okay, so we see that the highest percentage is occurring with the injury to the heads, followed by injury to the elbow and forearm, and so on. So there are actually many types of injuries based on ICD-10 diagnostic codes. So I've just listed the top categories, and in all others there are actually quite a few, probably more than 30 other categories, which I combined them and showing as all others. So in terms of percentages, we see that the Windsor Essex County it has a higher percentage of head injuries, and but not on the other categories. They're kind of similar. So these are now the percentages by region, by age categories. So we have used the chronic disease age categories, that is less than 19, 20 to 44, and so on. So we have 65 to 74 and 75 plus as well. So one thing to note here is that, again, this column is for Chatham-Kent, this is for Lambton County, and this is for Windsor and Essex. And we see that the percentages of fall-related injuries, the most are occurring under 19, which is actually higher than these last two categories combined. So for Chatham-Kent, and the same is for Lambton County. So if we combine this, there will be around 27%, but again, under 19 is actually more than 30%. But for Windsor Essex is kind of similar. So we notice that the most of the fall-related injuries are occurring under 19 and over 65. So now I'll show you some rates, because the crude numbers are useful for planning to know the magnitude, but it doesn't tell you per capita, so we need to know the rates. So crude, I'll show you some crude rates and some age-specific rates, and some standardized rates. So crude rate is actually the total number of year visits divided by the total population per 100,000. And age-specific rates are the same thing per age group. For example, the total number of visits for related visits in a given age group divided by the total the total population. Actually, population in that age group. It should be population in that age group, not the total population. And the standardized rates are also defined like this. I'll just keep it. So, although we have noticed that the most of the fall-related injuries or ER visits are occurring in Windsor Essex County, but if you look at the rates, we see that clearly the opposite. So, Windsor Essex had the lowest rate per 100,000, and the Lambton County has the highest rate of fall-related emergency visits. So, Chatham-Kent is just under the Lambton County. So these are the age-specific crude rates for each region. The first block of here, this is for the under 19, and this is for 20 to 44, and so on. And here is 65 to 74, and the last one is 75 plus. And these are the crude rates. Clearly, Windsor Essex County has the lowest rate for fall-related ER visits for all these years. And we see that the scenario changes for this particular age group and this particular age group between Lambton and Chatham-Kent. And also it shows some sort of trend that's going upward, but we have to do further analysis to see if that trend is actually significant or not. Now I'll show you some age standardized rates because crude rates sometimes doesn't tell you the real picture because of age differences in different age categories. So there's another way of finding a rate, that is the standardized rate. I cannot go into further detail, but these standardized rates are useful for comparing different regions. So although the numbers itself, like the rate itself, this number is an artificial number, so these rates should not be used for planning purposes, but just for comparison purposes. So this blue is for Windsor, Essex, and the maroon is the Chatham-Kent, and the green is the Lambton County. And I've calculated the confidence intervals for each of these rates. And clearly, what you see from here is that the rates in Windsor, Essex County are statistically significantly lower than the rates in Chatham-Kent and Lambton counties. And Lambton County has the highest rates of fall-related year visits during the entire period that it considered, 2006 to 2010. And as I mentioned, these rates are for comparing different PHUs in Erie St. Clair. And for actual magnitude of falls, we should use accrued rates. For calculating the standardized rates, we have used 1991 Canadian population as the standard population. There are possibilities of doing further analysis. For example, we can calculate rate by type of injuries. That will give us further insight. And we can also do, of course, we should do in future the sex-specific and the sex-adjusted rates along with the age-adjusted rates. We can also do age-sex-adjusted rates for each PHU and each region. And we can, using those rates, we can compare actually county versus LHIN and other areas as well. Another important aspect would be to identify the risk factors that can be done, and we can use possibly we kind of have to merge or link several data sets in order to be able to pinpoint the exact reasons or to determine the factors. And in terms of mapping through GIS and association studies, Sagar will talk more about it. And of course, a regional falls report is certainly a possibility. So now I'll hand it over to Sagar, our spatial analyst.
Hi everyone. I would like to thank you for the invitation, and I'm going to present some colorful maps for the Erie St. Clair LHIN for the falls rate. So for different age categories. So this map is showing the falls rate per person, the average falls rate per person in age under 19 in Erie St. Clair LHIN. So this is of course at the very basic level analysis, and the rates are per DA, dissemination area. So each polygon is a dissemination area. So basically dissemination areas are the smallest geographical level defined by Statistics Canada. So as we see, the rates, if you look up the legends up there, so the areas with white colors means that no falls occur. I mean, no patients with any falls is living in this area. And for example, a rate of 0.2 means that we have 0.2 falls per person for that DA in that age group. So this is for age under 19. As you see, there are some red DAs, which means that we have, for example, at least 0.8 falls per person in that DA, which looks high, but the problem with this kind of mapping is because in some DAs we have very small population, and those rates, of course, cannot be reliable. So further analysis needs to be done. So if we move along the maps to different age categories, this is for age 20 to 44. You see you're seeing much more darker colors than lighter colors. Lighter colors, of course, means that we have more falls per person. This is for the age 45 to 64, and this is 65 to 74 and 75 plus. So if I move back and if I have a quick show of these maps, then you will realize that at the middle ages we have less falls, but at the age under 19 and above 75 we have more falls. So I just have a quick show. You see at this age group we have more lighter colors, right? So meaning that we have higher rates of fall. So this is just a closer look for the age 75 plus at Chatham-Kent County, Essex, and we may also be interested in finding out any association between socioeconomic status and the falls rate. Maybe people with low SES value have more falls, for example. So this is the map of the SES. So it's income quintiles. So 1 is the lowest income and 5 is the highest income. At the DA level for Erie St. Clair. So if we have a closer look, for example, this is just an example. At City of Windsor, this does presents number of falls for the patients living in those DAs. So as we see here, we have more people having more falls at the DAs or at the areas close to Riverside rather than everywhere else. And if we have a look at the income map, we see that most of those areas are located in the DAs with the lowest income value. So maybe there is a kind of association, but of course it has to be tested and to see whether this association is significant or not. So the problem with investigating the health risk is that most of the time we are dealing with small populations. And of course in the small populations we have small observed and expected events, which will of course makes the risk estimates unstable, and finally we will have misleading risk maps. Especially this is the case with the areas that are quite large in area, like this one, but having few population, and of course this area with their unstable risk estimates will dominate the whole map. So you will get a maybe wrong or false interpretation. So in order to overcome this problem, we have to move on to the next level, which is using advanced spatial analysis.
This is where everybody's head blows off.
So, especially we have to use Bayesian techniques, which is the most powerful techniques nowadays to model and parameter estimations or risk estimates and so on. So, which can be done for future. Thank you.